This episode is brought to you by... Oops, I've got a box of Cheez-It crackers staring at me and I just wanted that irresistible cheesy crunch. Sorry, that was a total snacksident. What was I supposed to be talking about? So salty, so crunchy, so cheesy. Whoops, lost my train of thought. I've heard of brain freeze, but brain cheese? I'll just have one more Cheez-It cracker and then I'll get back to it.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 oncology questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you'd like to get involved in this project, please reach out to me at ted.medprep2go@gmail.com. If you like what we're doing, please give us a review and let your friends know about this project. All right, let's get started with the first question. A 45-year-old woman presents to her primary care physician with a palpable lump in her right breast that she noticed 2 weeks ago. She denies any breast pain or nipple discharge. Past medical history is negative, and she does not take any medications. Her last mammogram was 1 year ago and was normal. She has no history of breast cancer in her family. Vital signs are within normal limits. On physical examination, there is a 2-centimeter firm, non-tender mass in the upper outer quadrant of the right breast. An ultrasound of the breast reveals a solid mass that is not clearly identified as a cyst. Which of the following is the next best step in management? A, administer antibiotics and observe. B, order a follow-up ultrasound in 6 months. C, perform a core needle biopsy. D, schedule a mammogram, or E, surgical excision. The correct answer is C, perform a core needle biopsy. Every palpable breast mass that is not clearly identified as a cyst by ultrasound in a woman over 35 years of age should be biopsied to ensure that a breast cancer is not missed. A core needle biopsy is the preferred initial approach in most scenarios to obtain a tissue sample for histopathological examination. Fine needle aspiration, or FNA, with intraprocedural cytopathology is an alternative that may expedite patient management. Answer choice A, administer antibiotics and observe, is incorrect. Administering antibiotics and observing is not appropriate for a solid breast mass, as it could delay the diagnosis of a potential malignancy. Answer choice B, order a follow-up ultrasound in 6 months, is incorrect. Delaying further evaluation with a follow-up ultrasound in 6 months is not appropriate for a solid breast mass, as it could delay the diagnosis of a potential malignancy. Answer choice D, schedule a mammogram, is incorrect. While a mammogram can be useful in the evaluation of a breast mass, the next best step in this case is to perform a biopsy to obtain a definitive diagnosis. Answer choice E, surgical excision, is incorrect. While surgical excision can be used to remove a breast mass, it is more invasive than a core needle biopsy and is not the first-line approach for initial evaluation. The key learning point here: every palpable breast mass that is not clearly identified as a cyst by ultrasound in a woman over 35 years of age should be biopsied to ensure that a breast cancer is not missed. Question 2. A 79-year-old man presents to the clinic for worsening shortness of breath, dry cough, and chest pain for the past 5 months. He also states that for the past few months, he has been feeling exhausted throughout the day and has had 15 pounds of unintentional weight loss. Past medical history is significant for mediastinal Hodgkin lymphoma, diagnosed 20 years ago, that was treated successfully with chemotherapy and radiation therapy. His other medical conditions include hypertension and hyperlipidemia. Current medications include lisinopril and rosuvastatin. He has consumed 4 to 5 alcoholic beverages per day and smoked 1 pack of cigarettes per day for the past 30 years. He has worked in the local shipyard since his early adulthood and retired 19 years ago. Vital signs are temperature 37.1 degrees Celsius, which is 98.8 degrees Fahrenheit, blood pressure 138 over 88 millimeters of mercury, pulse 97 beats per minute, and respirations 19 per minute. Body mass index is 18.2 kilograms per square meter. Physical examination reveals dullness to percussion and reduced breath sounds on the right side of the chest. An electrocardiogram shows normal sinus rhythm. A chest X-ray reveals marked diffuse opacification of the right middle and lower hemithorax with blunting of the costophrenic angle. A contrast-enhanced CT scan shows circumferential nodular pleural thickening of the right lung. Pleurocentesis is performed and reveals a bloody exudate. The patient subsequently undergoes a thoracoscopic biopsy. Histologic analysis shows invasive epithelioid cells with enlarged hyperchromatic nuclei and prominent nucleoli. The cells are positive for calretinin and cytokeratin 5/6 on immunohistochemistry. Which of the following had the most significant role in the development of the patient's current condition? A, alcohol consumption. B, history of prior malignancy. C, prior occupational exposure. D, radiation exposure. Or E, tobacco smoking. The correct answer is C, prior occupational exposure. This patient with long-standing shortness of breath, cough, and chest pain has imaging and histopathological findings consistent with malignant pleural mesothelioma. Mesothelioma is a malignancy of the pleura, which is a thin membrane that lines the surface of the lungs. Pleural mesothelioma usually develops in older males and most often presents with chest pain and dyspnea due to an underlying pleural effusion, which is the most common initial finding in these patients. After an initial chest X-ray, which usually shows a pleural effusion, further evaluation may include thoracocentesis, which classically yields a bloody tap, a contrast-enhanced CT scan of the chest, which usually shows pleural thickening, and a pleural biopsy. Histology may show psammoma bodies, although these are nonspecific for mesothelioma. On immunohistochemistry, calretinin and cytokeratin 5/6 are positive in mesotheliomas and negative in most carcinomas. This is an important distinguishing feature between mesothelioma and lung carcinomas. Electron microscopy classically shows polygonal tumor cells with desmosomes, tonofilaments, and microvilli. By far, the most important risk factor for the development of pleural mesothelioma is exposure to asbestos, usually in the workplace. The lifetime risk of developing mesothelioma among asbestos workers is thought to be as high as 10%. The use of asbestos in the United States has ceased, but any exposure at any point in life can still put a patient at risk of developing mesothelioma, even long after the exposure has ended. Some of the occupations associated with asbestos exposure include shipbuilding, roofing, mining, plumbing, and insulation work. Answer choice A, alcohol consumption, is incorrect. There's no evidence that alcohol consumption increases the risk of developing mesothelioma. Heavy alcohol consumption does, however, increase the risk of hepatocellular carcinoma, breast cancer, and esophageal carcinoma, among others. Answer choice B, history of prior malignancy, is incorrect. The patient had mediastinal Hodgkin lymphoma 20 years ago that was successfully treated. A relapse could present as new onset painless supradiaphragmatic lymphadenopathy, the return of B symptoms such as fever, night sweats, and weight loss, and imaging findings consistent with Hodgkin lymphoma. The current imaging and biopsy findings suggest that a different malignancy has developed in this patient. Answer choice D, radiation exposure, is incorrect. The patient had chemotherapy and radiation therapy 20 years ago for Hodgkin lymphoma. Although there is evidence that radiation therapy to the chest might increase the risk of developing mesothelioma even after long latency periods, it is not the primary risk factor in this patient, who has a likely history of occupational exposure to asbestos. Answer choice E, tobacco smoking, is incorrect. Although smoking increases the risk of developing lung cancer and many other cancers, it is not implicated in the causation of mesothelioma. A current consensus view is that asbestos exposure and tobacco smoking interact synergistically for the causation of lung cancer. The key learning point here: pleural mesothelioma often causes hemorrhagic pleural effusion, which is the initial presentation in most patients. Histology can show psammoma bodies, and electron microscopy classically shows polygonal tumor cells with desmosomes, tonofilaments, and microvilli. Calretinin and cytokeratin 5/6 are positive in mesotheliomas and negative in most carcinomas. Asbestos exposure is the strongest risk factor, whereas tobacco smoking does not independently increase the risk of developing mesothelioma.
With new, gentler scented Clorox disinfecting wipes, clean finally smells as good as it feels on everything from lamps to ceiling fans, even on your kid's toy shark. Oh, ouch. Clorox disinfecting wipes, now available in crisp lemon. Find it on Amazon. Clorox, clean feels good.
Hey, Ryan Reynolds here for Mint Mobile. You know, one of the perks about having 4 kids that you know about is actually getting a direct line to the big man up north. And this year, he wants you to know the best gift that you can give someone is the gift of Mint Mobile's unlimited wireless for $15 a month. Now, you don't even need to wrap it. Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.
Question 3. A 52-year-old woman presents to her primary care physician with a palpable lump in her left breast that she noticed 3 weeks ago. She denies any breast pain or nipple discharge. She has no family history of breast cancer. Her last mammogram was 1 year ago and was normal. Vital signs are within normal limits. On physical examination, there's a 3-centimeter firm, non-tender mass in the upper outer quadrant of the left breast. An ultrasound of the breast reveals a solid mass. A core needle biopsy is performed, and the pathology report confirms the diagnosis. Which of the following is the most likely diagnosis? A, ductal carcinoma in situ, or DCIS. B, invasive ductal carcinoma. C, invasive lobular carcinoma. D, medullary carcinoma. Or E, mucinous carcinoma. The correct answer is B, invasive ductal carcinoma. Invasive ductal carcinoma, or IDC, is the most common type of breast cancer, accounting for 70 to 80% of all breast cancer diagnoses. IDC begins in the milk ducts and then invades the surrounding breast tissue. It can present as a palpable mass and is often detected through imaging studies and confirmed by biopsy. Answer choice A, ductal carcinoma in situ, or DCIS, is incorrect. DCIS is a non-invasive form of breast cancer that is confined to the ducts and has not invaded surrounding tissue. It is often detected through mammography as microcalcifications. Answer choice C, invasive lobular carcinoma, is incorrect. Invasive lobular carcinoma, or ILC, is the second most common type of invasive breast cancer but accounts for only about 10 to 15% of cases. It begins in the lobules and invades surrounding tissue. Answer choice D, medullary carcinoma, is incorrect. Medullary carcinoma is a rare subtype of invasive breast cancer that accounts for less than 5% of cases. It has distinct histological features and a better prognosis compared to other types of invasive breast cancer. Answer choice E, mucinous carcinoma, is incorrect. Mucinous carcinoma, also known as colloid carcinoma, is a rare subtype of invasive breast cancer that accounts for about 2 to 3% of cases. It is characterized by the production of mucin. The key learning point here: invasive ductal carcinoma is the most common type of breast cancer, accounting for 70 to 80% of all breast cancer diagnoses. Okay, so that's it for this episode, but please do check out our other episodes, and a reminder that you can find all of these questions at medprep2go.com.